We're Dr. Sandra Southard, Dr. Fern Webb, Dr. Juan Luque, and Dr. Lourdes Vazconde Garbonate, co-leads for the Community Outreach and Engagement Corps of the Florida, California Cancer Research, Education, and Engagement Health Equity Center. CaRE2 is a bicoastal cancer research and training center that brings together researchers from Florida A&M University, the University of Florida, and the University of Southern California.
We CaRE2 Health Equity Center is funded by the National Cancer Institute Center for Reducing Cancer Health Disparities. CaRE2 is committed to eliminating cancer health disparities and promoting health equity among Black, African American, and Hispano and Latino adults living in California and in Florida.
Our center focuses on 3 specific cancers: prostate cancer, pancreatic cancer, and lung cancer. We want to welcome you all who are listening to our We CaRE2 podcast.
Now we would like to introduce you to our host for this first season, Pastor Rhonda Holbert. She's a breast cancer survivor and an advocate, and the founder and CEO of the Celebrate Life Cancer Ministry, which is a nonprofit multicultural organization available to anyone affected by cancer and their families. Pastor Rhonda also serves as one of our CaRE2 Community Advisory Board members.
Welcome to We CaRE2, the podcast. This is a conversation on cancer in the Black community. Join us as we explore the journeys of resilience and triumph with Black people impacted by cancer. Each episode delves into the unique challenges faced by Black community in dealing with cancer and illuminates the intersection of race, health, and hope. I am Pastor Rhonda, founder of Celebrate Life Cancer Ministry, and your host for We CaRE2, the podcast. I would like to welcome our guest today, and our topic is navigating the healthcare system. And today we have with us Fayetta, Justin, and Janeal Majors. Hello, ladies.
Hello. Hi, how are you?
I'm awesome. And I'm in California, they're in Florida. So this is definitely a nationwide experience that we're going to have today. And a conversation that just, broadens our information and our perspective on what's going on in the healthcare system. And I have to put emphasis on the system. Because I'm actually going through a situation caring for a loved one right now, and there were bumps and lumps, and processes weren't happening. And one of my brothers straight out just said, "I think we need a new doctor." I said, "Stop, time out. We don't need a new doctor. We need to understand the system." And once we understand the system, then we will find out that the doctor we have is A-OK. And I was able, because my loved one is in Las Vegas, Nevada, and I live in California, and I was able to get the doctor in Nevada to talk to my oncology doctor in California, and they came up with the same solution. So I recognize truly, we don't want to bash doctors. We want to make sure that we're looking at the system and even how our doctors and healthcare professionals have to navigate it as well. All right. Is that fair?
Yes. Fair enough.
Okay. But you know what? I really would like to talk to Janeal first. And Janeal, can you give us your testimony before we get started talking about the healthcare system?
Okay. I'm at the time I was 43. I went in for a mammogram, and of course I got that because I always had fibrocystic breasts. So I don't know if you're familiar with that, but that's density in the breast, fatty tissues in the breast. And usually with the fatty tissues, it's hard to detect if something is wrong because it's so much tissue in the breast. So I always have to get the 3D mammogram when I go. So I got that call to go back. And it was so weird because when I got the call to go back, actually with my insurance, I think the next visit was going to be like $300 or $400. And so I was like, you know what? I'm not going back. I'm not going back. And then I thought about it. I'm like, okay, Janeal, just go. It's just money. If you got it, just go do it. So I did go back. I went back actually 3 different times because you have to go back for the second mammogram. Then you have to go back for the biopsy. Then, so at that time I did go back and I got the news. I went back for the biopsy. So like maybe 3 days later, and usually I'm the person on the other line. I'm usually the nurse calling the patient, telling them the news. So of course I was at work. It was afternoon, and I got the call from my doctor's office, and she was like, "Hey, Miss Major, I just want you to know your test came back and it was positive." She didn't give me much. She didn't give me what I gave to my patients. So she was like, "Your test came back positive and you have breast cancer." So of course, I panicked because no one wants to hear the word cancer. So of course, I panic. I'm nervous. The first person I called was my mom. I didn't even call my husband. And then she went to crying, and I was like, "Mom, it's gonna be okay." But I didn't understand it. So I left work and I went to my doctor's office and I just explained to them, like, "Look, I do what y'all doing. And the way you called me, I'm not pleased with it. I need to understand what is happening here." And that's when she explained to me it was ductal seroma, which my case of breast cancer is like a stage 0. They caught it so early. My surgeon, which is Dr. Crooms, he said back in the days where he come from, he's been a surgeon for over 30, 40 years. He said they wouldn't even consider what I had breast cancer, but over the years, they had to call it breast cancer because it showed something there. He was like, "We'll go in, we'll do the lumpectomy, and we'll remove everything. You don't," because at that time when they told me about the breast cancer, before I even got in with Dr. Crooms, I went into patient mode. So I treated myself like I would treat the patient. So Dr. Crooms is one of the top surgeons, and that's who the doctor that I worked for at the time, which is Dr. Andrea Randall, that's who she referred all the patients to, no matter what, because her confidence in him was awesome. Like, she knew he gonna get the job done. So I scheduled with Dr. Crooms. I scheduled with hematology oncology. I scheduled with either a plastic surgeon. So because I'm young, at that time I'm 43. I'm thinking about my kids. I'm thinking about my baby. I'm thinking about, like, I'm gonna lose my breast. I went into panic mode. And so I did all my appointments. I ended up going to the plastic surgeon. He tried to hire me on the spot, actually. he wanted me. And the doctor that I work for, because she's been in medicine for like 30 plus years, her name speaks for itself. So once you go, and of course I had on my uniform at the time, the first thing they asked, "Oh, what do you do for HC? What do you do?" And I was like, "Oh, I work for Dr. Rhonda." They know right then, okay, we know what we dealing with. We got to come with it because she's going to go back and report to Dr. Randall. So at that time, the plastic surgeon, he was like, "Well, Miss Major, you don't need to be here." He said, "Your spot is so small." He was like, "It's your decision." He said, "And some women your age, they want the double mastectomy." He was like, "But because they don't want to be done with it anymore." He said, "But technically, that's usually older women." He said, "Usually with a woman your age, they don't want to not have breasts." He was like, because you're still at that age. So it was a big decision for me. But once I got to the surgeon and he told me everything, he was like, "I go in." He told me what he'll go in at. And, he was like, technically it's a stage, 0. They'll pull out the lymph node, just to make sure everything is good. And what I did was I did the surgery and the radiation here, but I got the second opinion. I go to Mayo as well. I had to just treat the thing about it and not even questioning the doctors here. I had to do what's best for me. Even when seeing the hematologist and the oncologist here, it's a little tough when you got other people in that pot. You know what I mean? But I know that Mayo is one of the places that we send a lot of our patients to as well. So I was like, you know what? I got to treat myself like the patient, and I need peace. You know what I mean? I need to feel good. And so I got doctors everywhere. I have the surgeon here, which is Dr. Crooms. He just retired this year. I did my radiation here at HCA. I did 16 days of radiation. Um, and I didn't have to do chemo. And so my oncologist here, she put me on the 5-year pill. So when I went to see my doctor at Mayo, they got all my tests back, and that's why people they think about it like too many people is in the pot, but sometimes it's good to have that many people in the pot, because you got to get everybody on board, and you got to figure out what is the best option for this patient. So at the time I had started taking the pill, I had been on the pill for like a month, and my oncologist here had put me on it. So when I went to see Mayo, they looked at all my tests. They was like, you shouldn't be on that. We're not going to have
What
you.
are you talking about?
It was the tamoxifen.
A
Yes.
chemo. Okay.
Yep. And so she was like, all your stuff came back, and she was like, no, we're not going to have you taking that. And you don't have to take that. And I think, and I'm like, see, that's why it's good to have, because I would have been on that pill, taking a pill that I didn't have to take for 5 years, which that pill is awesome, but that pill also gives side effects. It gives you endometrial cancer. Like, it's so much, because I'm still young. I'm not postmenopausal. I still get my periods. So my situation is a lot different from older people's situation. I still have to get a PAP every year, because I could still get pregnant. I can't do birth control. I can't. So it's been a whirlwind, but I can truly say, like, I am truly blessed, because what I thought at the time my life was like, because when you think of cancer, the first thing you think of is death. I'm just being honest. You have to be real with yourself. And I'm like, Lord, but when everything was all said and done, even now, I don't, for my first bit, because for a year you go back, Mayo had me coming back every 3 months. They don't play, like, they all about it. And then even like here, when I seen my hematologist here, she want to order a mammogram. I go to Mayo order a mammogram, a MRI. So it's like, what do you do? And I just, I came up to the fact that I have to do what's best for me. But like I said, I'm 2 years out. June the 29th of this year made 2 years, but it's a scare every time, because I went in March, and they thought they seen something. And of course, you got to go do the biopsy all over again. And God knows, it's like a roller coaster. And the thing about it with Mayo, you get your results before anybody. You get your results before the doctor. They're posting your results. So it's been a smooth walk, because you got those 6 months now in between, because like I said, I just had one in May. I'll be going back for my next one next year. And then I give God like all the praise. Sometimes I feel so guilty, because I'm like, I'm not giving him enough, because he spared me, so. But it's a whirlwind. It's a whirlwind.
Wow, it's definitely. And how long was your journey from diagnosis to completion of treatment, or the immediate
My
treatment?
whole maybe 6 months. Because once
Okay.
once I found out, it was like surgery, radiation. You know what I mean? They were so good. So I can truly say, because I did 16 days of radiation, but I couldn't work during the radiation, because the radiation made me so tired.
Yeah.
And this the kicker too. So of course, going to radiation is the breast. How about I had to pray, because I didn't want to go on medication during radiation, because you're going in this machine for this. And so my mind was all over the place. You wouldn't believe what got me through radiation.
Tell me so I can know.
I counted the clicks. I counted the machine. So you go through then you go through the middle. Then you at the end. then you know you coming out. Because I couldn't, I was like, Lord, give me a way. I said, because of course I could have got some medication to relax me, but I didn't want to do that. I wanted to do it on my own. And I counted the clicks in the machine. That helped me through my 16 days.
Okay. All right. And I'm, like I said before, it's truly good to see you and to hear your excitement and the energy that you have having gone through that far. Amen. So, Faye, tell me, what do you do and how do you fit into this conversation of navigating the healthcare system?
Well, first, I definitely rely on the providers and the MDs that we have in place. And they would not be where they are without good support staff. So making sure that, because I manage, yes, let me give you a little emotional with talking about her story. I manage to make sure that they have all the tools that they need to be successful and that the patients have everything they need. So if the doctor is needing social workers, or if they're needing the case managers, if they're needing help with getting prior authorizations done, whatever is needed so that patient can have a flawless experience, that's the angle, and that's where I come in.
So what is that title called? Because I'm going to tell you, I'm going to walk in the next hospital and ask for your title.
Well, it's a practice manager.
A practice manager.
Yes.
Do all hospitals or oncology offices have that?
What I would suggest, yes, they do. But if you're going to do it at the hospital, I would say ask for the nurse navigator.
Okay.
That is where because that nurse navigator is your resource of all your information. And everything that you think you may know, she knows that and then some, because that's her job, and she has the resources, she has the support, she has all of the what do you call it, the drug reps, everything behind her to give her what she needs to set the patients up to success.
Okay. So a nurse navigator. Okay.
Correct.
So when I think about my own personal journey through inflammatory breast cancer, and that was 23 years ago, when I think about that, I literally had no interruption in care. I had no interruption in anything. My job continued to pay me, so I didn't even have to do disability till the second go round. I had a support team, and we called them the hospital posse. To the point that whenever I had any appointment, I would go, and so would my mom, my cousin, my pastor, and his wife. And whenever we would go to the doctor, and the girls would all come in the room with me, to the point that one time I went and the doctor came in and he went, 1, 2, 3, somebody's missing, I'll be back. He knew he must have just been in the restroom, because he's like, I'm not repeating this twice, right? Because they had questions, I had questions. So, I had a hospital posse. So I personally did not experience any challenges in my care, right?
That's good.
And so I was with, and still am with, Kaiser Permanente.
Well, I know one of the things that they do with HCA, you were saying that nothing as far as any interruptions in pay. HCA, and it depends on who you work for. Janeal was able to take advantage of the family medical leave. So her job was secure. If there was an issue with paying, we have the Hope Fund, which, she didn't have to tap into those, but, we have other patients or other, should I say, employees that maybe would need to tap into something like the Hope Fund, or definitely going into the FMLA.
Okay.
Family medical leave. And the good thing about our navigator services, they're free to every cancer patient. So there is no expense, no out-of-pocket cost.
Awesome. So, but when I had started caring for my loved one who's going through cancer right now, every test, whether it was a CAT scan to a MRI to a PET scan, was what MRI, CAT scan, MRI, in that order. Everyone was 30 days away, and you already know they have cancer. Nobody was trying to help us move this process along, and they're not a young individual. So, and one of the things I'm gonna say this, and hopefully I won't have to say it again, but one of the things I realized with cancer on this, because I've been the founder of Celebrate Life Cancer Ministry for 23 years.
Mm-hmm.
One of the things that I realized is cancer does not kill people. Time does.
Mm-hmm.
So if you're putting 30 days in between every test, then that's 90 days before you're even going to come to a conclusion to begin strategy on what you're going to do to care for that person.
So my suggestion, and is it based on the insurance? Because a lot of times it's the insurance that the patient has.
No one said. No one
I'm
told
sorry.
us. No one told us what it was.
Okay. Oh,
We
wow.
came up with a solution.
Mm-hmm.
And that solution, and because I got very frustrated and I had to tell the doctor, look, I'm a patient navigator. And I know that I need to get her these tests sooner than that. What can we do? He said, well, the only other thing you could do is if she was in the hospital, then she can have it done. I said, well, guess what? The hospital is the next building. So I'm going to the hospital. So you do what you have to do to get her seen when I get over there. So he went the back way, I went the front way, and she was admitted and got every single test she needed.
Yeah, and we do have a lot of patients that we will get them admitted.
Yep.
Because a lot of times the insurances won't pay, or it's going to take that time in between. Well, yeah, I mean, of course, it's definitely not the route that we would want everyone to take, but there are some circumstances where they have to. But I also know every hospital, every insurance company, whatever insurance they have, you call that insurance company, you let them know, hey, I've been waiting. No one's giving me the help I need. They're going to send a letter to me, and I'm going to have that letter because that doctor, our clinic, no one wants to be on that list because that insurance has the option to say, I'm not going to send you any more of my patients. So if they're Blue Cross Blue Shield, you don't want to lose that flow of those patients. So you're going to do what you have to do so they can complain to their insurance company. Every hospital has an administrative team. Trust me, that administrative team does not want to not be in the green. They don't want any complaints because you go to straight to administration and you pass everybody, you go right to the CEO. You go to the compliance officer. You know, you're going to get heard and you're going to get some results.
Awesome. Okay. And I think that's what people need to know. Because there, and don't get me wrong, there are systems put in place for a reason.
Yeah.
But when you're looking at your life versus the system, we have to do everything that we can to save our life or to save the life of a loved one. You know, when you get to the oncology department and you see the different, and it's my eyes are different as a caregiver than they were as a patient. As the patient, I was pretty much, okay, I'm trusting my doctor. My doctors are talking to me the way I need them to talk to me. They're explaining things and everything was moving right along. But when I started looking at it from the standpoint of not just being a navigator, but also a caregiver for someone specific, you start noticing the different types of people that have support and don't have support.
Yeah.
You know, and go ahead.
Another avenue, and a lot of people think palliative care service is just when you're on your deathbed, and it's not.
It's not.
So I would say reach out to the palliative care service team. You will have a plethora of support and information. And I mean, everything from, you know, the emotional counseling to art therapy, music therapy, everything you need. And if they don't have it, they will point you in the right direction. And
I totally agree because we ended up doing that as well. However, because pain was associated at a great level, we also, the family opted to put the loved one in hospice.
Okay.
During those 90 days when nothing was going on, no care, no prognosis, no nothing. we opted for hospice, but we have to be mindful that when you're in hospice, you cannot be receiving doctor care.
Oh,
So
wow.
once
Okay.
the doctor care began, then we came out of hospice and went to palliative care.
Okay.
So then, because the pain, I can't even begin to describe how bad the pain was, but you can't get that kind of pain medication through palliative. And
Got it.
palliative,
I,
tell us again what palliative means.
So the palliative care, and if I'm not speaking out of term, they do offer, and there's some assistance with pain management as well. Um,
It wasn't enough for
it
what that
wasn't
person
enough.
needed. Yeah.
Okay. Yeah. So, and I actually, for some reason, I, just kind of looked up because I thought you were maybe going to ask me that question. So just to make sure, it's a care type of specialized medical care that provides physical, emotional, spiritual support for people with serious illnesses or chronic conditions. It can help manage the physical symptoms and emotional stresses and focuses on the patient's goals, values, and what's important to them. So palliative care can be appropriate at any age, at any stage of serious illness, and it can be provided along with curative treatment.
Exactly. And in partnership with the doctor's care.
Correct.
Okay. So yeah, so I like I told somebody, people can graduate from hospice, and hospice
Hmm.
generally means end of life or that you're not in care but you still need support.
Correct.
Okay. But palliative, and we as a community need to understand that, because
Yeah.
we'll turn down everything.
Yes.
Just say,
Yes.
oh no,
And
I
I
can't
find
afford it.
when they say palliative, oh, but they're not dying. It's not just for that. So just open your mind to be okay to explore and be okay with focus groups. Some people don't want to do focus groups, but you can pick up so many tips from people who have already gone through it. Why reinvent the wheel? If they've done something that works, you can get information, from those type of groups.
So
So
would you say a focus group is similar to a support group, or are they different?
no, I would say that they're kind of one and the same. Some people call, I would say, to me, we do the focus groups because the focus groups is going to focus more on it and give you more of that. I wouldn't say data, but outcomes and prevention, you know, where the support to me is more warm and fuzzy. Let's just talk, sit around and talk about how I'm feeling. Where the focus is going to focus on the points and let me guide you to where you need to go to get the help you need. Some people just want to have that support to, I just need someone else to hear what I'm saying and let me hear what they're saying. And that's all I need, so that's what I find the difference, having worked with both.
Would a focus group be related to research, kind of?
When I would say yes, because when I did most of my focus groups, it was like research driven, and the numbers and the data that we did get from the focus groups helped us determine what's needed to then get these services to people.
Okay.
Hmm.
What are some of the challenges that you've seen with individuals navigating the healthcare system?
Not being open to what's recommended, tunnel vision, maybe hearing from a loved one who says, oh, well, so and so did that and they didn't do this. Like, just keeping your options open to other things, new things. It's not like it was in the 60s, 70s, 80s. I mean, there's so much out there. Stay off of WebMD and get your
Okay.
information. Get your information directly from the doctor's office, because you can go on WebMD and they will have you thinking that you're just not going to make it after 2 weeks. So, while there's a lot of information out there, be selective on where you get your information from.
Right. And I totally agree, especially when you start searching cancer in general.
Yeah.
And, and you have, like for me, I had inflammatory breast cancer. So at
Hmm.
the time, only 3% of the people got that. And then there's
Okay.
triple negative. So if I'm looking up triple negative and I have
Yeah.
inflammatory, then I'm reading side effects and medications and
Hmm.
different things that have no relationship to what I'm going through at all. So
Correct.
that's real important. I'm with you. Stay off of web
Hmm.
and Google, Dr. Google. He doesn't work.
Exactly.
But I don't have a problem taking what you found back to your doctor and seeing if this is the same as what you're experiencing.
Mm-hmm. That's
However,
true.
I have watched doctors' faces go, why are you wasting your
Right.
time over there? You could have just called me or just gone online and emailed me the
Mm-hmm.
question and we could have handled this. And, because your appointment might be 2 weeks away. So now you've got
Mm-hmm.
2 weeks that you're exploring with something that you had no business doing because everything
Mm-hmm.
doesn't agree with whatever the process is that the doctor is doing.
Correct. Right. You may
Yeah.
have to take a different path. Yours may not be exactly lined up with what it's saying. The information is out there. So, and like you said, just be open to it. And also, don't be afraid to get web enabled at your clinic or whatever. You don't always have to have a doctor's appointment to come in. You can contact your doctor via the web, you know, the patient portal, things like that. I find that a lot of the older patients, they don't want to, get on the portal, but you have access to your doctor kind of 24/7. And if it's one that's totally dedicated, a lot of them have their computers at home and they'll answer you right away. So,
Mhm.
mm,
So when we talk about communication with the healthcare providers, is there a recommended method? I know we talked about emailing them, but are there certain trigger words that a person can use? Because I remember once I had, because I actually had a lumpectomy, mastectomy, um,
mm,
6 rounds of chemo, no, 10 rounds of chemo, and then 25 days of radiation. It took me a year and 15 days to finish
wow.
my journey. And when it had reconstructive surgery
Mm-hmm.
and it wasn't right, I then kept asking them for an addition for a prosthesis. And my insurance was denying it because they said you already had
Mm-hmm.
surgery. That makes sense to the average person, but I ended up having to call the Legal Cancer Research Center to be able to find out what verbiage can I
Mm-hmm.
use based on my situation of a surgery gone wrong, still needing to be put back together. What do they call it? Symmetric, being able to become symmetric to the rest of my body.
Okay.
And they gave me the words that allowed the insurance company or the doctor to communicate to the
Mm-hmm.
insurance company so that I got what I needed.
Yeah.
So have you seen situations where individuals um there's situations that come up that if
Yeah.
we just had the right set of words or the right mindset to
Yes.
communicate with the healthcare providers, rather than getting frustrated.
I have seen that. Have you seen that as well? I've
Mm,
seen it on our, because maybe you hadn't so much with the provider you're with, but working on the billing end of it. So that's the part when the claims are coming through and someone will get denied on the claim. And the insurance company will say, well, if the doctor would have said it was this opposed to
mhm,
that, then I
Wow.
could go ahead and pay for it. All right. So once the claim goes out the door, it comes back as an IET, which means the insurance company scrubbed it and they said, we're not going to pay for this. It's not right. They send it back to our office. And a lot of times we can present it back to the provider and say, hey, you said it was this, but if you say it was that and code it this particular way, the insurance company will cover it. And so we have had that happen. And that's smart that you went down that avenue. And I would say always challenge everything. Challenge the bill, challenge the provider. Sometimes even with something as simple as lab work, they'll put down a particular lab and they'll say that they want to order that lab for the patient. And then the insurance company will say, well, based on what you put the patient had, they're not going to pay for it. But then if you read through the notes, they maybe just excluded and didn't add that particular one. They may have talked about it, but they didn't put it in their notes. If they put it in the notes, they code for it, the insurance company will now pay for it. So
Okay.
challenge everything.
because one thing with the insurance, it has to be shown medical necessity.
Mm-hmm.
And if it's not shown that it's medical, the insurances are not going to pay for it.
Okay. That makes sense. So would it be best, like if something comes up, is it best that I go to my doctor and ask, how is this coded because the insurance isn't paying it? Or
Mm-hmm.
not how is it coded? Because now that's challenging their ability and I don't want to do that. But It be coded a different way so that insurance would pay for it? Does that make sense?
You,
Can
It
we ask
does.
it
them that?
Does, but we don't, being on the other end, because I'm the patient and I'm on the other side doing the work as well. We don't take that personal. No MD will take that personal, because at that time you want to do what's best for the patient. We don't want our patients getting bills from their insurance company. They already paying a lot of money for insurances. So we don't want them with that lets the patient know we're not doing what we're supposed to do, because in patient care, that the patient care is what comes first, nothing else. In doing what we do, it's all about the best patient care you can give a patient. So never feel that the doctor or the nurse will be offended in whatever questions you may have, especially when it comes to billing, because we don't, that falls back on us, as we're not doing what we're supposed to do, because it's certain things the doctors and the nurses should know how to code for that patient. And when something come back, it's up to us to fix it. No patient should be coming out the pocket if they don't have to, because of a code we missed.
Now, what I do tell some of the patients is call your insurance company before. If, say, the doctor tells you you need a particular test, call your insurance company. Hey, my doctor said I need this. Where should I go? Because a lot of times we will refer them to a place in the insurance company. We don't know all of the insurance companies. We ask the patient to take ownership of that part of their care. Call the insurance company, say, hey, they wanted me to get an ultrasound. Should I get it at this place or should I get it at that place? Well, will you cover 100% or 80% or 50%? Then you
Wow.
go back to your doctor and you say, my insurance company said they will cover it if you send me here. Takes the stress and the guesswork out of it.
So with the medication, you have a brand name and you have a generic. So sometimes the doctor don't know what your insurance gonna cover. So he was saying, of course, either one, the brand name or the generic. So a lot of times we have to tell our patients, hey, call the pharmacy back and see what's in that line that your insurance may cover, because it won't cover that medication. So it's other, like, say for instance, let's use Majaro for instance for that medication. So some insurances won't pay for that, but then we have Trulicity, we have Ozempic. So we have to tell our patients, hey, you have to call the pharmacy and see what in that brand, what in that line of medication will your insurance pay for. And they have to call us back and we'll send right in what the patient have to that's free for the patient. So we revolve it right back to the patient, because we could only do so much. But when the ball is in the patient, because technically with the patient, they own their insurance. You're the one can make the insurance. You could get what you want from your insurance company. When we call them, they give us all kind of, they give us the runaround. But when that patient calls, that's a whole different story. They're gonna get what they want.
And they think we just don't want to do it, but we don't own the policy, you do. And you owning the policy speaks volume, and there's strength, there's power in that. And I don't think a lot of people know that. You could even challenge the insurance company to say, hey, you're not going to pay, but I need this. I've been paying you for X amount of years. You kind of have more control and power than you think you do.
So as a patient navigator, could you be on the call with me when I call the insurance company?
Oh, yes.
As well as your caseworker and your social worker. They will all three chime in and get on that insurance call with you. Absolutely.
Okay, because a lot of times as the patient, you're so overwhelmed with just going through treatment. If I could just get somebody to help me, direct, we have chemo brain, we've got, all kind, you're just overwhelmed. I'm sleepy, I'm tired, I'm exhausted, whatever the case might be. So if to know that you can pick up the phone and call somebody that will advocate for you while you're on the phone, that would solve a whole lot of stuff.
That social worker is gold. The social worker, I know the one we have here, even our case manager, a lot of times we're trying to just get a patient's A1C down. She will call all over. She will send somebody to do the A1C check. They do so much more than we can do here at the clinic. So reach out to those services. That's their job. They want to help you and they want to do it.
Awesome. And then the other thing is, because caring for my loved one, we ended up identifying foundations within the medication company that actually provided
Mhm.
the medication at no cost.
Yeah. So we have the drug reps that come here, and we've
Mhm.
had some drug reps. We're like, hey, we have Miss Smith or what have you, and she's having a problem financially because they don't know that the drug reps, they're given X amount of dollars allocated to them and X amount of, how do you say, gratis type medications and things and coupons that they can give out to the patients. So go to your doctor and say, hey, get with your drug rep, because that Ozempic rep, they want to make sure we're writing that prescription. So they're going to give us whatever it is. Even with the lab, you get a lab bill that say you can't take care of, or say we sent it to the wrong lab and you're getting the bill. We can call, we get so many as a clinic, so many that they'll write off at the end of the day. Just be that patient to make that call, speak to that manager, and you can make it happen.
Awesome. So as we start wrapping up our little time here, looking back on everything that we've talked about, what advice would you give to others navigating the healthcare system while dealing with cancer?
So as the patient, what would you give?
Let's see. I would just, tell them never give up, no matter how hard it is. Basically, because with trying to get what you need, it's always back in our hands. Don't give, no matter, because I know we all get overwhelmed, but it's your care. It's up to you. Don't give up, no matter, because the resources is out there. You just gotta look it up, ask your doctor, and you could get whatever you need. Just don't give up. Don't give up on yourself, no matter how hard it is. Even though I didn't experience that, but like you said, I know so many that has. And just know that it's people out there that can help you. And what I noticed too, with going through what I went through, what helped me to get through some things is talking to people that has been through the same exact thing that you have. That give you a big peace of mind. I'm just being honest, and I had to experience that, because at first when I went through this, I was so secretive, I was so private. I couldn't do this a year ago, what I'm doing with you right now. And just, because my life is my life, and at the, people was like, wow, why you didn't tell me, why you know, because I had to I can't tell you anything when I don't know to figure this thing out for me. So, I just give people, I just, please, just, if it's somebody that that done went through what you're going through, it helps to talk. They will help you get through it.
So on my end, on the administrative end of it, do realize that you have managers, you have navigators, you have people that even above my pay grade, they don't want to be on anybody's radar as not being the practice or the hospital that did not give this person what they wanted. Push, push, push. Don't stop, and keep being aggressive with your care, because no one's going to love you more than yourself, and you can speak for yourself better than anyone else can. No question is dumb. No questions out the ordinary. Make your list, baby step it, make your check off list. If you want to research on the internet, get your little research, write it down, bring it to the professional provider, that can help you with it. But just don't take no for an answer. People take more time looking for a vehicle than they do trying to navigate what's going on with their health, so give that same energy.
Awesome, awesome, awesome. And people need to know that they're not alone.
Oh, yes,
This is a
that's the
journey.
key.
So many.
And most of the people in the oncology department, and that whole team,
Mm-hmm.
they literally are there because they care.
Yeah.
Mm-hmm.
Literally there because they care. And so that brings us to the conclusion of our We CaRE2, the podcast, a conversation on cancer in the Black community, talking about navigating the healthcare system. And we've taken it at a different direction than I originally had in mind, but I know that this is going to be a blessing to many. So I thank you, Janeal Majors, for sharing your testimony and your input as a professional. And Faye Justin, thank you so, so much. Look forward to,
Absolutely.
and we're all part of the CaRE2 team, right?
Right, right.
So before we leave, Faye,
Yes.
tell us, how has being part of the CaRE2 team been a benefit to you?
Oh my gosh. I tell everybody I'm going to give HCA maybe 24 more months, and then the rest of my time is going to be working with the CaRE2 team, the with FAMU and all of the community outreach. It's just really rewarding. I started off in public health and preventive medicine back in when I was in New Orleans at LSU, working with the Ryan White grant, those infected with HIV, doing those focus groups, gathering the data, doing the Robert Wood Johnson alcohol, tobacco type stuff, on underage kids. It was just rewarding. So continuing the community outreach, it's just been a blessing. I wish we get back to the breast cancer part, because that's where I started. We would do mammograms for those in underserved areas. And we don't have that piece of it anymore. So I would love for them to get that piece back. But I think it was the first year we probably screened over like 400 ladies for breast cancer and 2 males, so doing that, following up with them after a year to make sure that every year they go back to get it done. It's just it's my niche. It's what I like to do. I could like not even do I love the managing piece of the HCA, but that community outreach piece it's just where my heart is. So
Awesome.
love it.
Well, ladies, thank you so much for your time, and we look forward to sharing this podcast with others. And until next time, just know that
Yes.
we care too.